Now, before we move into what will be a very brief description of some of the other rewiring phenomena that psilocybin can induce, and then into some of the therapeutic applications of psilocybin as they relate to these recent, really exciting clinical trials for depression and addictive disorders and things of that sort, I just want to cue everybody to a paper that I think many people will want to take a look at in thinking about psilocybin. And I'll provide a link to this paper as well in the show note captions. This paper is entitled Therapeutic Use of Psilocybin, Practical Considerations for Dosing and Administration. And this is a wonderful paper because it really goes step by step through the pharmacology of psilocybin, of which you now understand a bit, but it goes into a bit more detail. But then it also really nicely describes the contour of a psilocybin session and what's happening at the level of chemistry, early, middle, peak, and toward the end of the psilocybin session. And then also importantly, it gets into issues of dosage and translating from mushrooms to psilocybin itself to psilocin, things I talked about earlier, but in a bit more detail if you'd like to see that detail. And then perhaps most importantly, there's a section on contraindications where it points out that, of course, women who are pregnant or breastfeeding, people who have a predisposition to psychosis, those people should really avoid the use of psilocybin and other psychedelics entirely. It also talks about where the evidence is strong, moderate, and weak for the use of psilocybin for treatment of various disorders. And I can just summarize that very quickly because it's where we're going to head in a few minutes, which is that the most evidence for positive therapeutic outcomes in response to psilocybin taken and conducted in the manner that we've been describing today in terms of dosage and journey, set and setting, is for cancer-related depression, cancer-related anxiety, and treatment-resistant depression. That's where most of the evidence resides. There's also some evidence for the use of psilocybin journeys. And again, this is typically 1 or 2 psilocybin journeys spaced, in the cases of 2 journeys, anywhere from 1 to 2 weeks apart. And again, with all of the same contour of supports and setting that we've been talking about today. And there's some evidence for improvement in terms of outcomes in alcohol use disorder and dependence and tobacco addiction. And then finally, there's the least amount of evidence, although there is clinical trial support for relief or partial relief for obsessive compulsive disorder, cluster headaches and migraines, and demoralization due to AIDS diagnosis. Okay, so this paper has a lot of really interesting information in terms of different conditions, in terms of dosage, and again, contraindications, and what's called adverse events. What sorts of bad things can and do happen as a consequence of psilocybin and other types of psychedelic journeys, both during and after those psilocybin or psychedelic sessions. And we'll talk a bit more about this when we go into some of those clinical studies, because adverse reactions is always a key measure in any clinical study. So very soon we'll get into the more recent clinical studies related to psilocybin for the use of treating depression and some other conditions.